Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families in the Berkshires, Pioneer Valley, and beyond. I'm your host, Rachel Colasino, and I have very special guests for today. I have Sandra Shepard, who's the Executive Director at Kimball Farms in Lenox, and Mark Alinger, who's the Administrator at Linda Manor Extended Care Facility in Northampton. Welcome to you both.
Thanks, Rachel.
Thank you for being here.
Absolutely.
So our topic today is a rare and national award called the Gold Excellence and Quality Award, which both Kimball Farms and Linda Manor won. And that award is given through the American Healthcare Association and the National Center for Assisted Living. Before we get into that, though, I want to set the stage because I want to make sure that we're explaining how rare and how special this award is. So both facilities were awarded the Gold Excellence and Quality Award this past year. It's extremely rare to win this award, and even more so rare for first-time applicants, which both of your facilities were first-time applicants. So we're going to talk about that. We're going to talk about the very intense application process, the waiting period, which I understand was nerve-wracking and nail-biting, and what it was like at each building when you received the news that you had won. And then, of course, what it means for Berkshire Healthcare as a whole. So that's what we're going to cover today. So I'd like to start with if we can just talk about what the Gold Excellence and Quality Award is and what it means. Superior performance in long-term and post-acute care professions. So what does that mean?
Well, the award was established in 1996, as you said, by the American Healthcare Association, and it's designed to measure superior performance that demonstrated superior performance over a span of at least 5 years. So it's really looking for a trend that a facility can demonstrate of their journey towards healthcare excellence.
And it's a few different steps. I mean, you can't just win the Gold Award. First, you have to win the Bronze Award.
The Bronze Award. And then the Silver Award, and then the Gold Award. The Bronze Award focuses a lot on development of mission and visions as an organization to make sure that you have a focus. The Silver Award takes it to the next level and takes your mission and vision and focuses on quality outcomes and your ability to sustain superior performance. The Gold Award is kind of a culmination of all of those. The Gold Award takes sustained performance through measurable outcomes and goals over an extended period of time. So it pretty much measures your ability to sustain systems and processes rather than just having process in place to fix something in the moment. They want to make sure that you have sustained performance over an extended period of time and you're able to maintain those systems. I know our data, we looked at 5 years worth of data in order to do that. And we had to submit 5 years worth of outcomes clinically and in areas of customer service and employee engagement and excellence.
In each of those awards, so the Bronze Award was one application process, the Silver Award was another application process, just longer and more extensive, and then of course the Gold was even longer application process.
That's right.
So Kimball Farms won Bronze in 2010?
Yes.
Silver 2011, Gold 2013. And Mark, Linda Manor was Bronze in 2009?
That's right.
Silver 2011, Gold 2013. So this award measures a lot of different categories, and so what I'd like to do is kind of walk through those categories and then find out, because both of your buildings, even though you're award winners, you're also very different. You have very different staff and a very different from each other. So I want to talk about how each of you are able to include that in your application. So leadership is the first major piece of that. So how was leadership measured in your applications?
Can we start? I think with our application, there was a general theme throughout our entire application. The theme focused on, we have an internal philosophy of do the right thing. And it's a culture that we've been working on and the leaders in the building have been establishing for many, many, many years. Kimball Pride is also another sort of theme and philosophy that we have throughout the building. And we needed to show in the application that that culture of Kimball Pride and do the right thing was embedded not just at the leadership level, but at the staff level as well. And they would talk to staff members, and they were interviewing the staff members about the mission and vision and the culture, and making sure that everything that we were trying to promote from within the building on a leadership level was brought down to the lower level and brought to the staff level, and that they understood that philosophy and that culture.
I think similar to what Sandy and her team did, our leaders were and are adept at articulating a vision for their teams of what excellence in healthcare looks like, and then proceeding to help each member of their team, play to their strengths, to find out what they could do to bring that to fruition. So I think it involved leaders who really know their team well, and could play to their strengths.
That's great. And then, so strategy. So I know we have an organizational strategy at Berkshire Healthcare, and then so that was part of it, but then each of you had to also demonstrate how you are carrying forth that strategy. So what did that look like?
Well, I think Berkshire is a visionary in what they do in many ways, but with regard to your question, they defined where we were to go, but they allowed each facility the flexibility in their own path to get there, recognizing that there's not necessarily a cookie-cutter approach that works best. So I think giving us the latitude to discover our own path to reach that end result was very helpful from where.
Berkshire established strategic objectives, as you said, throughout as an organization, and we needed to not only implement those strategic objectives at the facility level, but as Mark said, we were given the latitude to be able to expand beyond that. So if there was a goal or a measurable objective that Berkshire Health Systems, if the facility had already met that objective, we were able to extend that beyond and kind of develop our own above and beyond that, which then led us to be able to continue that culture of continued excellence. We never wanted the building or the staff to become complacent if they met an objective, to think that that objective was always met. So we took it to the next level and would kind of expand on that objective and try to make it beyond and have the staff achieve higher levels of excellence.
So you're demonstrating to the American Healthcare Association that you set the bar and you continue to raise the bar. You never settle.
Right.
That's right.
That's great. Okay. So, customer focus, I know, is also an important piece of the application, and defining who your customers are, and then how you find out what their needs are, and then how you meet those needs. So how does each of your buildings do that?
Well, we took an incredibly methodical and deep-seated approach. We asked them, what do they want from us? We could have spent a lot of time, doing something more convoluted, but we simply had a conversation with our customers. And as you said, it began with figuring out who are our customers, and really establishing a relationship with them, and ensuring that once we agreed on what the objective was, then agreed on timeframes and strategies for how we would get there.
Great. How about you, Sandy?
We also focused on that. I think it's very important to have those relationships with the families and with your customers. And in doing that, we also wanted to find ways to measure that. So we, like Mark, utilized the My Interview national tool, which is a measure of customer and, we'll find out later, employee satisfaction as well. And we constantly assess that data. Even though we try to survey people that have gone home, we survey people annually to kind of get feedback. More so than the questions, we look at a lot of the comments. So even though someone may have scored us excellent in an area, I tend to, and the management team tends to look towards the comments to kind of get more feedback. because questions can be black or white.
Right.
It's either, how would you rate this? Is it excellent, very good? But we look to the comments to see and to kind of get more ideas about what else we can do to improve the customer experience.
I think in constantly sharing the results, as you said, Cindy, with our staff, the phrase we use is connecting the dots so that staff could see the impact that they were having with respect to our customer relative satisfaction. And if we were doing things very well and our customers were asking us to accentuate that, we would share that with staff. And if customers revealed to us that there was an opportunity to do something better, we'd invite our staff to see how we could make that happen as well.
Good. And so, that plays into as well that customer engagement. So, like Mark had said, asking people what are you looking for, but also how are we doing, and then continuing to ask that question. So, customer engagement was a piece of that. So we talked about the measurement. So you had to include 5 years worth of data in your applications. What was it like pulling that information together? I mean, that must have been an extensive process.
That's a nice way to put it. It was a mammoth undertaking. Because as we've pointed out before, we're not statisticians, we're not accountants. We're healthcare providers. So to have to collect such a voluminous amount of data was challenging. But by the same token, it helped validate what we knew was true anecdotally, and so to go back and see that validation that wow, the trends really were we're heading in the right direction is very reaffirming.
I think it was good to share that information too with the staff.
Absolutely.
It was very eye-opening, even though we collect data almost every day, whether it's the weekly Director of Nursing report or monthly Director of Nursing reports. There's a lot of clinical data. We have various areas that we can get that data from. I think to collectively put it together during the application and actually see the progress and see where you were 5 years ago and where you've come and how you've maintained and sustained, which I think is the hardest part of this process. I think you work to achieve a goal, and a lot of times once you achieve that goal, that's kind of where it ends, and it can never end there, and I think that was the hardest thing. I think sometimes it was harder to sustain than it was to achieve the goals, and to not slip back or to have the staff so motivated that there was never complacency, there was never a time where complacency set in, or to keep the staff continuously motivated where people didn't get comfortable with the outcomes and the success that you had enjoyed. Needing to be able to continue that pride and have the staff motivated. I think that was, so the data was useful in doing that, because you could say, look, we're still doing this, and this is good. And I think that was a nice tool to be able to use to keep them motivated and inspired.
And it sounds like being able to show that progress is probably what the American Healthcare Association was looking for.
Yes.
When you received those awards. So we're going to take a short break. We're going to hear a little bit more about Kimball Farms Nursing Care Center, and we'll be right back.
Nestled in a quiet neighborhood just a short walk from the offerings of downtown Lenox and just minutes from Tanglewood, the summer home of the Boston Symphony Orchestra in picturesque western Massachusetts, Kimball Farms Nursing Care Center offers you the best of both worlds. It's a locally run facility staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Kimball Farms Nursing Care Center is part of the Kimball Farms Life Care Retirement Community that includes independent living, Pine Hill Assisted Living, and the Life Enrichment Program for those with Alzheimer's disease or related memory impairments. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Kimball Farms is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Kimball Farms, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, and hospice and respite care services. We also provide services that fill specific needs of the community, like our Alzheimer's program, dedicated to individualized care, maintaining dignity, and the highest quality of life for these residents. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Kimball Farms is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Kimball Farms receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Kimball Farms Nursing Care Center, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-637-5011. We look forward to meeting you.
Welcome back. So I am here today with Sandy Shepard and Mark Alinger from Kimball Farms and Linda Manor, which are recipients of the American Healthcare Association Gold Excellence and Quality Award. And so we're talking about how special this award is, and I just want to put this in context again. So this award program started in 1996. It's a national award program. Since 1996, only 18 nursing homes in the country have ever won this award, and you are two of those winners, so congratulations.
Thank you.
Thank you.
So I want to talk about the application process. We've talked a little bit about what you included in the application, but we're talking 5 years of data and a lot of information. So how long did it take you to write your applications?
The longest year of my life.
About a year, yeah.
About a year.
Yeah.
Yeah.
And how was your staff involved?
They actually, we would have meetings to go over each section, and the staff, we would sit down and go over some of the questions because the application was so detailed. There were numerous questions in each of the sections that you were talking about earlier, in the leadership and the strategy and customer engagement. And so there was a series of questions and process questions that you had to answer, and we would take that information to the staff and to the management team and sit down and kind of go over and get their feedback about things that they felt needed to be included in the application. And so we really took a lot from the staff and used their input in the development of writing and the application.
In addition to what Sandy said, which I agree with completely, I'm also considering the fact that the staff did the hardest job of all by actually providing that care and causing those outcomes to happen. What Sandy and I were largely doing was just cataloging the fact that they did it, and they're doing these wonderful things each day. And we had the privilege of making note of what they do, and they do it so well.
So you submit the application, and the next step is you find out that you have a site visit.
Yes.
So not everybody who submits an application gets a site visit. So it's the next step before winning the award. So take me back to when you find out that you're getting a site visit.
That was a great feeling of relief, because we know that only a small fraction of those that apply for the award receive a site visit. So
I called Mark, he called me.
That's right. That's right. It was a wonderful feeling of relief in that that the first hurdle has been met. So our feeling was that we present very well on paper, to be sure, but the real experience is to be in the facility, to see staff in action, to, if you'll pardon the corniness of it, to feel the love, to feel the compassion, to feel what makes us unique. So we were cautiously optimistic that when they set foot in the building and felt what we offer, that would do well.
I think there was tremendous organization that was necessary for the prep for that. When you get the site visit, you have kind of a schedule of things. The purpose of the site visit is to kind of almost validate all the systems and the processes that you talked about in the application. And to look back, you had probably 16 hours by which to really explain 55 pages of an application and to make sure that all that information was validated. So I remember looking in my office, and we had things on the floor, and they were color-coded and numbered, and because you only had so much time to be able to present the data, and you wanted to make sure that you included everything in there to be able to validate all the important points that were in the whole application seemed very important. So trying to pick out what was the most important, I think that was tough. But
I remember hearing a story about you, Mark, which is that you were preparing to write your opening marks for the site visitor. So you were struggling with it, and you asked your staff, what should I say? And they said to you, just speak from the heart. And I think that when you did that, it probably helped to win them over, right?
Well, I hope so. I think we so wanted to be prepared for the surveyors. We know that the American Healthcare Association, if they are anything, they're very organized and meticulous and methodical, and they need to be. So we were following that same line in our own preparation. But you're right. I think there was a certain time, where we just said, listen, we've come this far. Let's not. Let's be very transparent and just let them know this is what we feel is most special about Linda Manor, and this is the culmination of a lot of work, on behalf of a lot of people in 5 years. Let's just explain that to them very simply, and I'm glad that we use that approach, because I think it was honest.
Okay.
Yeah, I think my director of nursing and I think after a couple hours into the interview process. I think we were nervous that we weren't given the right answers, or are we not using the right terminology? And finally we kind of decided amongst each other that we need to just tell our story. I mean, we have a great story to tell, and we need to just tell the story. The story will speak for itself, and that was kind of the direction that we ended up taking. I think after a couple hours we kind of figured that out, that we need to tell the story, and the story will speak for.
Mm-hmm. That's right.
Yeah.
So you had the site visit, and then a few weeks later, you find out that you won the Gold Award. So this, again, just to put this in context, this is an extremely rare award. It's an extremely rigorous application process. Most facilities who win don't win it the first time they apply. They apply, and then they reapply.
That's right.
And so both of you won it on the first award. So can you take us back to that moment when you found out that you had won this thing?
Well, I think we got notified in July. Right? It was during the summer, so we had a lot of staff on vacation, and I want to say it was about 6 weeks before we were going to find out whether or not we won, between the site visit and the actual notification of whether you won or not. And I think I was so honored, and we knew they had to get back to you by a certain date in July. And the staff, the employees knew that date, and what really was heartwarming for me was the fact that even though I had staff members and employees and everyone was so bought into this, that I had people calling the building from vacation wanting to know if we had heard. So there was that level of buy-in and engagement and pride from the staff, so it was very exciting. So I got to tell them, yes, we did win it, and they were excited. And then immediately our thoughts went to Linda Manor too. And it was funny because Mark got notified, and we didn't know that he had won, and he didn't know that we won. And we were both concerned about each other's buildings, and we were saying, well, we're excited we won, but we didn't want to win without them winning. And he's saying, hopefully, I don't want to win without them winning.
That's right.
And then we ended up calling together because I think someone at the corporate office knew that we had both won and kind of relayed the message so we could call each other, because it was really nice for both of us to win at the same time. I think it was actually a nice relief.
Absolutely.
I think.
It was just a great outpouring of emotion on the part of the staff. It was, again, it was validation from an independent third party that all their work has been noticed. All their efforts over all these years, it's been validated and acknowledged. So it was tears and hugging, and it was just wonderful, absolutely wonderful.
So congratulations again to both of you, and congratulations on winning this amazing award.
Thank you, Rachel.
Thank you both for being here.
Thank you.
This has been InfoSource, a presentation of Berkshire Healthcare Systems.